Arun Suwar Saduhi. I hope I was able to pronounce that correctly because that's the only Khmer I know. So that's supposed to be good afternoon, everyone. My name is Dr. Fred Ting. I'm a medical oncologist from the Philippines. And this morning I'm tasked to talk about choosing wisely and why is it an important step in moving towards the right direction. So these are my disclosures. And the objectives for this morning's talk are the following. Hopefully at the end of the presentation, we would all be able to somehow describe the history of this initiative, recognize the different ongoing collaborations around the world, and discuss the different lessons learned from a decade of the Choosing Wisely campaign. And of course, we would want to see enthusiasm from everyone towards the future direction of the Choosing Wisely campaign. So, before we do something, we first need to understand why is there a need for this campaign? Why is there a need for stewardship? And if we look at the history in the United States, several studies would show that health expenditures are increasing at unsustainable rates. And I think this is true all over the world and not just in the US. And approximately 30% of healthcare costs are on wasted care. Wasted care actually means unnecessary care that we give our patients. And this, the American College of Physicians pegs this at a little more than $750 billion annually. We also know that 1/3 of all physicians acquiesce or give in to patient requests for tests and procedures even when they know that they are not necessary. So this can be due to pressure from colleagues and even pressure from patients and their families. And we also know that physicians' decisions account for 80% of all healthcare expenditures. So putting this graphically, we see that a big chunk of wastage goes to overtreatment. So, what were the early inspirations of the Choosing Wisely campaign? In 2010, the medical ethicist Howard Brody called on medical societies to actually identify 5 overused tests and treatments in their specialties. This was adopted by the National Physicians Alliance using the American Board of Internal Medicine Foundation grant, where they tapped the different specialties of internal medicine, family practice, and pediatrics, and piloted developing that list. And that list was very, very simple. That's basically 5 questions where they encourage physicians and patients to ask, these are the questions. Do I really need this test or procedure? What are the risks? Are there simpler or safer options? What happens if I don't get the test? And of course, how much would it cost? And these questions evolved throughout the time, and eventually, a year later, the Choosing Wisely initiative was established with a mission to encourage conversations between doctors, clinicians, and patients by helping patients choose care that is, of course, number one, supported by evidence. Physicians and the healthcare team need to be updated of the latest developments in their field so that we ensure provision of the best possible care for our patients. We should make sure that the tests are not duplication of the previous procedures that patients already had. It should be free from harm, and of course, it should be truly necessary. And so I'd like to present how Choosing Wisely started in 2012 and how it has evolved to how it is today. So in 2012, the ABIM Foundation tapped 9 physician societies where they produced 45 clinical recommendations. Moving forward 10 years later, it now involves more than 80 physician societies with more than 600 clinical recommendations and more than 10,000 citations in medical journals. So we see how cooperation from the different countries and the different specialties would really improve the care that we provide our patients. This is a map which was produced a couple of years ago. This does not include Cambodia yet, and even us in the Philippines, but it somehow shows to you the work done by the Choosing Wisely initiative. And at the same time, it inspires us to move forward and to realize that a lot of work is still ahead of us. So now we shift gears and we try to explore what were the lessons learned from the past decade of this initiative, because it is through learning from what has been done in the past that we will be able to move forward and plan for the future. So first lesson is that physician professionalism and leadership changed how we think about overuse. So before the Choosing Wisely initiative, we always thought that giving more care to patients is better. But the Choosing Wisely campaign made us think otherwise and evaluate that attitude. So physicians are now considered as trusted advisors by the different key stakeholders in the provision of public health care. And physicians now have the capacity to persuade the public that overuse of diagnostics and treatment could actually also threaten their health. And now we know, and our patients know, that more is not always better. The Choosing Wisely campaign has also engaged professional leaders. In 2012, as I've shown earlier, there were 40 articles published in low-value care. 9-10 years later, this has exponentially increased to a little more than 600. Also, what's unique about the Choosing Wisely campaign is that it gives substantial autonomy to societies. So, Choosing Wisely does not dictate what societies should do, but instead it provides a framework where societies could work locally and to whatever is applicable in their own locality. So, through this, societies actually take ownership of the project, and it's very vital for societies to own the project for its success. So if you look at the Choosing Wisely website, you would see the different societies involved. There's a little more than 200 of them, and you may visit it later. So Choosing Wisely also increased the frequency of conversations about overuse. In journals, particularly the Journal of Hospital Medicine and JAMA Internal Medicine, they have sections dedicated on choosing wisely and overuse of diagnostics and treatment. Now we see special tracks on overuse in specialty society meetings, and we're very happy to note that in the different medical education and training programs, choosing wisely and avoiding the overuse of diagnostics and treatment are already being discussed and included in their curriculum. So as you can see, this actively involves new and potentially potent stakeholders. And I'm very happy to see a lot of young faces here who have the potential to change how healthcare is in Cambodia. And we also appreciate the presence of the senior leaders who are here, because you will be guiding these younger generation towards moving towards improvement. So another lesson that we learned is that hospitals and health systems looking to reduce overuse should implement multi-component interventions. It's very, very difficult to create change and to target specific stakeholders individually. We may do that, but at the end of the day, we should come together and align our goals. And this is pretty much exemplified by one paper, which was a review of more than 130 publications, and it showed that multi-component interventions actually resulted to 77% achievement rate versus single-component interventions, which resulted to a lower achievement rate. So it's really important to work together among your multi-subspecialty teams and to the different stakeholders of the country. Another lesson that we learned is that avoiding overuse protects patient safety. So it's a mindset change from what we know earlier, that more is better. Now we know that avoiding overuse is actually giving favor to the patients. So it seeks to minimize patient harm by encouraging shared decision-making, discouraging tests and treatments with little benefit, and recognizing the effect of financial toxicity. I'm not really sure how the healthcare system in Cambodia now is, but in my country, the Philippines, majority of the tests are still out of pocket. That's why and I think it's true to other low and middle income countries as well around the region, That's why it's very, very important for clinicians and all key stakeholders to really think about the diagnostics and treatment plans that we prescribe our patients if they are truly necessary. And I think this is the whole essence of the Choosing Wisely campaign. Dr. Ganguly and his team showed that in a study done in the US, that 87.5% of the services that the Choosing Wisely campaign changed actually carried a high or moderate risk of direct harm, or they were simply unnecessary. So you see how the impact of the Choosing Wisely campaign is evident in the United States, and this is a starting point for countries in Asia to follow. Another point that we learned from the Choosing Wisely initiatives is that overuse is an equity issue. We all know that minority patients who could not afford to get the standard of care, undergo a situation where they are placed in double jeopardy. And why is this so? Simply because they're the ones who are at risk of receiving less effective care, while at the same time, they're also at risk of receiving more ineffective care. So patients with lower income have been shown to be more vulnerable to financial harm from unnecessary care. And it's up to us to use the Choosing Wisely framework, modify it, create solutions to apply in our own region. So what is the future direction of the Choosing Wisely campaign? The main problem here, as we have presented, is the provision of low-value care. So Choosing Wisely, as I have emphasized, can only be part of the solution. It is not the solution, but it can be a framework for your societies to craft solutions with. So it's very crucial to involve key stakeholders, the health systems, physicians, and policymakers. And organizational leaders should take advantage of the tools provided by this framework to raise awareness, to reduce the healthcare overuse, which hopefully would translate to better cost metrics when you plan your costing at the beginning and at the end of the year. And we strongly encourage the Cambodian society to study and report on your own experiences, because this facilitates continuous feedback and improvement on targets. And believe me, publications from every country help other countries learn from what your initiatives are doing, so that essentially we would be able to do a cycle and movement of continuous improvement. So it's important to remember that through partnerships, collaborations, and shared efforts, we remain hopeful that Choosing Wisely campaigns such as this one can help reduce overuse and harms associated with unnecessary care, with the end goal of improving the quality and safety for our patients. This is a very nice phrase written by Dr. Vika Saini in the New England Journal of Medicine, where he said that the challenge is that overuse is a systemic problem. Thus, it needs systemic solutions. So I'm very glad to see all of you here today. I know you come from the different health sectors, the different levels of public health. And I encourage you that hopefully after this Congress, you would be able to come together and create solutions to improve the healthcare situation, especially for cancer patients in Cambodia. I'd just like to share that in the Philippines, the team leading the Choosing Wisely campaign are all my age group, so that's late 30s to early 40s. And it's very, very challenging to convince stakeholders, policymakers of this initiative. It's a very new initiative. It's the first time the Philippines has heard it. But believe me, after probably 16 months of meetings and engagements, we were finally supported by our department or Ministry of Health. And it's just a testament for everyone to believe that indeed great things come from small beginnings. So thank you very much. Maraming salamat po. And this is the team that will be hosting the Congress next Friday, Choosing Wisely Philippines. So thank you and good morning.
Thank you so much.